Hello, and welcome to this snapshot regarding other pharmacy personnel. This snapshot is part of the Medical College of Wisconsin School of Pharmacy, Wisconsin MPJE Review, Module 2. Of note, this snapshot includes recent PEB regulation changes that have gone into effect starting September 1st, 2024. I'll also note that the regulations and laws regarding roles and responsibilities of various pharmacy personnel, including pharmacists, technicians, students, are highly convoluted. And we have attempted in this presentation to organize them and make them easy to follow and understand. We're going to cover various pharmacy roles in this presentation. First of all, we'll cover registered pharmacy technicians, and this will include first and second year students who are working a paid job. We'll also cover student pharmacists that are divided into two categories in Wisconsin. First of all, first and second year students who are on rotation through a college or school, as well as another kind of separate designation of third and fourth year students, either on rotation or at a job. So we'll talk more about those and how those differences play out. We will cover pharmacy interns as defined in FAR 17. This is a legal definition that often but not always overlaps with student pharmacist. And then finally, we have two new types of roles in 2024, pharmacy graduates and uncredentialed pharmacy staff, and we'll talk about both of those. Before we get into the specifics of each role, it's worth spending just a little bit of time understanding the types of supervision that is required for each type of role. Wisconsin regulations defined two types of supervision, general and direct. General supervision is defined as continually coordinating, directing, and inspecting the practice of another. It doesn't imply necessarily physical proximity or necessarily being immediately available. This applies to less personnel than it did before. You can see that it applies to interns, P1s and 2s. However, as we'll see, this group can also be subject to direct supervision as well. Direct supervision, as defined in FAR 1, is defined as the immediate availability to coordinate, direct, and inspect practice. And so this does imply that a pharmacist is available in real time within moments of communication to provide advice or check another's work. This definition has been expanded to include not only in-person direct supervision, but also supervision by video, audio, or data communication. And so you can imply that this also includes teleconference calls as a means of direct supervision, telephone calls. Data communication could imply any of the above. Direct supervision, it's important to note, applies always to third and fourth year students. It always applies to students or technicians who are administering vaccines. And it applies to reciprocating pharmacists and pharmacy technicians who have applied to the board and are awaiting action on their application. It also applies to uncredentialed pharmacy staff. So direct supervision applies to almost everybody in our pharmacy. One exception for this, as you'll see in the notes below, the level of supervision for pharmacy technicians is actually not specified in our current regulations. So unless the technician is actually administering a vaccine, they don't have a specific level of supervision. All their work is required to be checked by a pharmacist, though, as we'll see in a bit. As I said before, first and second year students may also be considered uncredentialed staff and be subject to direct supervision. And so if there's ever a doubt, I recommend direct supervision for all students. And then finally, unlike some other states, there are no specified supervision ratios for any pharmacy personnel in Wisconsin. So there's no ratio of technicians to pharmacists or students to pharmacists that is stated in Wisconsin. All right, so let's dive into the roles, responsibilities, and scope of practice for pharmacy technicians. Since 2021, we've had legislation on the books that pharmacy technicians must be registered with the board. This is not a licensure, it's just a registration. They are subject to liability and unprofessional conduct rules, since we now have them as a specific role within our laws and regulations. More on that in Module 9. Under these new rules, as I specified before, supervision level is not indicated for technicians except when vaccinating or if they're working while waiting for the board to act on their application. Notably, first and second year students who are working a paid job and not on a school rotation must register as a technician to perform pharmacy tasks. Otherwise, they have no authority under the Wisconsin laws to engage in any pharmacy tasks. In order to register, technicians must be 18 years of age and have a high school diploma or their GED. Alternatively, they can be enrolled in one of Wisconsin's youth apprenticeship programs. After application, they can work as a technician while the board is processing their registration. Their registration is renewed every 2 years on June 1st, just like pharmacists and pharmacies. And in order to keep track of technicians' employments, they must notify DSPS of a new personal address or employer within 10 days of the change. So what can technicians do in their scope of practice? And this is pretty similar to what they were able to do before. They can perform technical dispensing functions, any other roles involved in prescription preparation, aside from the ones that are prohibited in FAR 19, which we'll discuss here in just a bit. They can perform inventory management roles, so anything that is required to maintain stock and supplies in the pharmacy, they can do that. Other things that they can do that we'll see in different modules, they can administer vaccines, which is more details in Module 8 on that one. They can perform product verification, or more commonly known as check tech, and again, more details in Module 8. And technicians that are appropriately qualified can staff remote dispensing sites. Again, we have a snapshot on that in Module 7. So what can a technician not perform? And generally, these are the duties involving professional or clinical judgment or interpretation. So things like drug utilization review, reviewing a prescription for accuracy and appropriateness of a specific drug product, reviewing the final label and the final drug product for accuracy, generally checking the final form of a prescription. However, there is an exception for a validated technician through the Tech Check program, as we will see in a later module. They may not do any patient counseling. They may make the offer to counsel, but they may not perform the actual patient counseling. That is reserved for pharmacists, students, and interns. Techs may not perform administration of non-vaccine drug products, vaccines only. And of course, they may not do therapeutic alternate drug selection. And even this is limited to pharmacists working in institutions with certain guidelines. Technicians may not supervise the practice of other techs other than the Tech Check Tech. They can be like a job supervisor and serve as a lead technician, for example. But they, other than the Tech Check Tech, they can't supervise the clinical work of another technician. All right, well, let's go through a few specific tasks and determine if a pharmacy technician can perform that task. So can a pharmacy technician accept written or electronic prescriptions? They certainly can. Can they request an authorization for a refill from a provider? Yes, they can. Can they perform drug utilization reviews? So we've seen before that this is not within their scope of practice, and this is a pharmacist, student, or intern. Can they accept a request from a patient to refill a prescription? Sure. Can they provide counseling or advice to patients on medications? Again, this is something reserved for pharmacists or interns. Technicians cannot do this, although they may make the offer. Can they obtain and enter data into the pharmacy's information system? Absolutely. How about preparing the label or affixing it to the container? Yes, this is part of drug prescription preparation. Counting, measuring, reconstituting medication, of course. Placing ancillary information on the label, yes. No, this will also be checked by the pharmacist after this is all done. How about provide final product verification? And again, this is usually reserved for pharmacists, interns, or students, unless the technician is verified through the TechCheck Tech program. And again, this is covered in a module later on in Chapter 7. So here are a few more responsibilities. Can a pharmacy technician do these? First of all, can they administer vaccines? The answer is yes, they can. And this is covered more in Module 8 in the vaccination snapshot. Can they administer injections or other drug products? And technicians cannot do this. This is limited to pharmacists and certain students. Can a technician sell pseudoephedrine over the counter? The answer is yes, they can, at the direction of a pharmacist. Again, we have a snapshot on pseudoephedrine in Module 6. Can a technician take or perform the controlled substance inventory? And yes, they can. They do this all the time. Can a pharmacy technician compound medication? And the answer here is also yes. And they must have certain policies and procedures in place in the pharmacy, but they are able to do this under those policies and procedures as developed. Finally, can a technician deliver drugs to a patient's home address? And they can certainly do this as well. Can a technician take a verbal prescription over the phone or facilitate the transfer of prescription information? These two tasks are slightly less clear in our laws because in FAR 7, these rules indicate that a pharmacist has to do this. However, in FAR 19, in the new FAR 19, techs are allowed to do any other activities that are delegated and supervised by a licensed pharmacist. So my interpretation is that, yes, techs are able to take a verbal prescription over the phone or facilitate the transfer of information for a prescription if the pharmacist delegates and supervises the tech and is comfortable with that technician doing that. Some pharmacies do not allow technicians to do either of these things based on a conservative interpretation of the law or because of workflow concerns. However, for accepting verbal prescriptions, again, techs are not prohibited from doing so, but remember that when a verbal prescription is taken over the phone, the pharmacist responsible for the accuracy of the information must be recorded in the prescription record. So every time this is done, and if it's done by a technician, they must record the pharmacist responsible for the accuracy and verification that the transcription of the phone call is correct. And this can be done, maybe the pharmacist is comfortable with the technician's ability, or maybe the pharmacist listens in or listens to a recording of the call as well. So tech can do this, but the pharmacist responsible must be recorded. Similarly, with transfer of prescriptions, technicians are not prohibited from doing so in FAR 19 and may be delegated this task by a pharmacist. Supporting this is that the DEA definition of pharmacist actually includes any person authorized by a state to dispense controlled substances under supervision of a licensed pharmacist. And so in Wisconsin, this includes technicians. However, remember also that transferred information must include the first and last name of the pharmacist. So the tech must be able to do that. In summary, it's my interpretation that technicians are able to do these two tasks, but you may find different interpretations in various practice settings. All right, let's move on to discussing pharmacy students, interns, and graduates. And we'll take these one by one, but kind of in the same section, since there is a lot of overlap between these three groups. Okay, so student pharmacists includes persons who are enrolled in a school or college of pharmacy. All right, so students aren't licensed or registered in Wisconsin. And in our Wisconsin statute, divides students into basically two categories: first and second year students, or P1s and 2s, and third and fourth year students, or P3s and 4s. So what is the scope of practice of a student pharmacist? Well, if a student pharmacist is on rotation, for example, in their IPPE or APPE, they are considered at this point an intern, and all students may practice pharmacy under licensed pharmacist supervision. Okay, so they can do any pharmacist task that the pharmacist is comfortable with and supervising them in their performance of those duties. If a student is enrolled in a school but is working at a paid job, so not through the school but kind of like a side job, for first and second year students, they must register as a technician to be able to perform any pharmacy duties, and at that point they are limited to the duties of a pharmacy technician. If they don't register as a technician, then they are considered uncredentialed pharmacy staff and are limited to the very few tasks that those individuals can perform. Third and fourth year pharmacists, on the other hand, are expressly defined in our statutes and may practice pharmacy under the direct supervision of a pharmacist. So while practicing pharmacy under the supervision of a pharmacist, student pharmacists, as I said before, can perform almost all pharmacist-only tasks, with the exception of those reserved for a managing pharmacist. So a student pharmacist couldn't be a managing pharmacist, so they're not allowed to perform those tasks. Important to note that if something that requires that the pharmacist responsible is recorded, and so this may be, for example, taking of a verbal prescription or transferring a prescription or something like that. If a student performs this, it must be the supervising pharmacist and not the student that is recorded in the prescription record. All right, I've talked about interns a little bit, and the term intern can be a little bit confusing. Let's look at the legal definition of an intern in Wisconsin regulations. Okay, so Wisconsin defines an intern as a person completing an internship for the purposes of licensure. So they are going through a course of experience that is required to complete their education or their licensure. Okay, so this is usually a student on rotation in an academic program. All right, so this could usually, most of the time, someone in IPPE or APPE, something like that. Occasionally can be another applicant working to fulfill any unmet internship hour requirements. Wisconsin requires 1,500 hours of internship for licensure. The confusion comes in where many companies will use intern as a job title. Okay, so they'll use a student intern or pharmacist intern as a job title for a paid job working at a retail or hospital pharmacy. Okay, this is something that is great for experience, and we certainly encourage our students to do this. However, they are not an intern in the legal sense. Depending upon how it is used, the term intern can refer to different individuals. For our purposes and for purposes of the MPJE, we need to be aware of the legal definition of intern. So pharmacy graduate is a new term in 2024, and this was created to fill a hole in our pharmacy statutes. So pharmacy graduate is defined as a graduate of a school or college of pharmacy who has submitted an application for licensure or is awaiting an examination. So this is going to be typically someone who has just graduated and who is waiting to take their boards or waiting on a decision from the board on their licensure application. Pharmacy graduates can perform most pharmacy tasks under direct supervision, just like a student or an intern. They can also specifically staff remote dispensing sites. Well, again, this is Module 7, but pharmacy graduates are specifically called out as being able to staff remote dispensing sites. A loophole in our current laws is that pharmacy graduates are not authorized to vaccinate. Okay, so they don't receive the authorization to vaccinate unless they are also a registered technician. A new category this year is uncredentialed pharmacy staff. Uncredentialed pharmacy staff includes those who are present in the pharmacy but who are not licensed pharmacists or registered technicians, anyone waiting to be licensed or registered, or in training to be a pharmacist. So this will include people like cashiers, maybe delivery drivers, or anyone else who happens to be present in the pharmacy. Note that pharmacy grads, aforementioned pharmacy graduates, and P1s and 2s who are on rotations are technically uncredentialed pharmacy staff, but accepted from all the rules. So don't think of them as uncredentialed pharmacy staff. However, first and second year pharmacy students who are working at a paid job, who have not registered as technicians, or who are not doing a school rotation are considered uncredentialed pharmacy staff, as they have no authority otherwise to perform pharmacy practice activities in a pharmacy. So just reinforcing that first and second years, in order to perform pharmacy activities, must either register as technicians or be on a school rotation. Uncredentialed pharmacy staff may not perform any pharmacy practice related functions. So they're not authorized to do anything related to prescription filling or dispensing or handling of medications, and this includes giving prescriptions to a patient, as this is part of the definition of pharmacy practice. Uncredentialed pharmacy staff require direct supervision by a licensed pharmacist, and the managing pharmacist must document the training and the delegation of all acts in the pharmacy to uncredentialed pharmacy staff. So thank you for viewing this snapshot on other pharmacy personnel as part of the MCW School of Pharmacy, Wisconsin MPGA Review, Module 2. We will have further practice questions in the companion questions for your review. Thank you, and I'll see you in another snapshot.